Have you ever felt like you're on a relentless emotional roller coaster, swinging from incredible highs to crushing lows? If so, you're not alone. What if I told you that for some people, these swings are so extreme they disrupt their entire life? This is the reality of bipolar disorder, a condition that affects up to 3% of the population. But what's really shocking is that it can take an average of 10 years to get an accurate diagnosis. Today, we're going to shed some light on this often misunderstood condition. So, what exactly is bipolar disorder? It's not just being moody. It's a brain disorder that causes extreme shifts in a person's mood, energy levels, and their ability to function day to day. Someone with bipolar disorder might experience periods of incredible excitement and energy, known as mania. Or they might fall into periods of deep sadness and hopelessness, called depressive episodes. It's important to know there isn't just one type of bipolar disorder. There are actually 3 main categories. First, there's bipolar I. This is diagnosed when someone has had at least one manic episode that lasts for a week or more. These manic episodes can be so severe that they require hospitalization. People with bipolar I may also experience depressive episodes, but the defining feature is the intensity of the mania. Next, we have bipolar II. This involves a pattern of depressive episodes and what are called hypomanic episodes. Hypomania is like a less severe form of mania. The highs are there, but they don't usually cause major disruptions in work or social life, and they don't lead to hospitalization. To be diagnosed with bipolar II, a person must have experienced at least one major depressive episode and at least one hypomanic episode. Finally, there's cyclothymia. Think of this as a milder, but more chronic form of bipolar disorder. A person with cyclothymia experiences numerous periods of hypomanic symptoms and depressive symptoms over at least 2 years. The highs and lows aren't severe enough to meet the full criteria for a hypomanic or depressive episode, but they are persistent and can significantly impact a person's life. So, how can you recognize the signs? Let's break down what these episodes actually look and feel like. A manic or hypomanic episode is more than just feeling happy. Mania is an elevated or irritable mood that lasts for at least a week. Someone in a manic state might have an inflated sense of self-esteem, feeling like they're on top of the world. They might need very little sleep, but still have boundless energy. They could become extremely talkative, with their thoughts racing so fast they can't keep up. They might be easily distracted, jump from one project to another, or engage in risky behaviors without thinking about the consequences, like going on a huge shopping spree they can't afford. Hypomania has similar symptoms, but they are less severe and shorter in duration. On the other side of the coin is a depressive episode. This is a profound sense of sadness and hopelessness that permeates everything. It's not just having a bad day. It's a period of at least 2 weeks where someone might feel a depressed mood for most of the day, almost every day. They might completely lose interest in activities they once loved. You might see significant changes in their weight or appetite, either eating much more or much less. They might feel constantly fatigued with no energy, or conversely, feel restless and agitated. Feelings of worthlessness or excessive guilt are common, as is difficulty concentrating or making decisions. In severe cases, there can be recurrent thoughts of death or suicide. If you or someone you know is having these thoughts, it's crucial to reach out for help immediately. Resources will be linked in the description below. So what causes bipolar disorder? It's not one single thing. Like many mental health conditions, it's believed to be a complex mix of genetic and environmental factors. There's strong evidence for a genetic link. If you have a close family member with bipolar disorder, you're more likely to develop it yourself. Researchers have found that certain genes related to how our brain cells communicate can be different in people with the condition. However, it's not as simple as one bipolar gene. Multiple genes are likely involved. But genes aren't the whole story. Environmental factors play a huge role. Traumatic experiences in childhood, such as abuse or neglect, or losing a parent, can increase a person's risk of developing bipolar disorder later in life. On top of that, major stressful life events in adulthood, like a bereavement, financial hardship, or homelessness, can act as triggers. potentially setting off the first episode in someone who is already genetically predisposed. It's this combination of nature and nurture that creates the conditions for the disorder to emerge. The good news is that bipolar disorder is treatable. Because it's a lifelong condition, treatment is focused on managing the symptoms and helping people live full, productive lives. This journey is best guided by a medical doctor, usually a psychiatrist who specializes in mental health. The first step often involves medication. Finding the right medication can sometimes be a process of trial and error, and it requires patience. Mood stabilizers like lithium are often the first line of defense to control manic or hypomanic episodes. For more severe manic symptoms, antipsychotic medications might be used. To manage the depressive episodes, antidepressants may be prescribed, but this is done carefully, as they can sometimes trigger mania in certain individuals. Short-term anti-anxiety medications might also be used to help with sleep and anxiety. But medication is only one part of the puzzle. Psychotherapy is absolutely vital. Cognitive behavioral therapy, or CBT, is a common approach. It helps people identify and change unhealthy thought patterns and behaviors. CBT can teach you to recognize your episode triggers and develop effective strategies for managing stress. Psychoeducation is another key component. Learning everything you can about bipolar disorder helps you and your loved ones understand the condition, which empowers you to manage it better. Family-focused therapy can also be incredibly helpful. Strong family support and open communication can make a huge difference in sticking to a treatment plan and recognizing the warning signs of a mood swing before it takes hold. The most important step you can take if you suspect you or a loved one might have bipolar disorder is to talk to a doctor or a mental health professional. They can conduct a thorough evaluation, rule out any other medical conditions that could be causing your symptoms, and provide an accurate diagnosis. Getting help is the first step toward managing the condition and reclaiming your life. Remember, you don't have to go through this alone. Thank you so much for watching and for taking the time to learn about this important topic. If this video was helpful, please give it a thumbs up and consider subscribing for more content on mental health and well-being. Take care, and we'll see you in the next one.